Recognizing the likelihood that COVID-19 would be a global pandemic, BHB started preparing in February.
We have been making some early preparations, obviously alerting the governors of the hospital, i.e. the board, and keeping them informed, securing the appropriate personal protective equipment, which was going to be required, making the appropriate purchase orders for increased beds and ventilators, and looking at how our pandemic preparedness stood up against this evolving challenge.
By late February and early March, preparations turned to conservation and prevention.
Limiting our utilization of potentially necessary resources and modifying activity which we could defer, although that was inevitably going to cause patient inconvenience. We had to take a responsible approach, reducing our elective surgical activity. The other area was around reducing our routine outpatient activity. That doesn't mean it doesn't need to be done. It just means that it might need to be deferred in the short term.
Planning now includes ways to increase hospital capacity to meet the demand if there is a surge in COVID-19 cases requiring hospitalization. These plans include discharging patients, increasing the number of acute beds, increasing the number of critical care beds, and increasing the physical clinical care space.
It becomes a primary goal, earliest safe discharge. We can't afford to have patients in hospital beds when they could be safely and effectively cared at a lower level of care. So that has been actively pursued. We are delighted to say that we were in receipt of just under 50 additional new hospital beds, which was a bit like Christmas. And these are being deployed. Currently, we describe our acute care bed capacity as being 120 beds. Our ambition is that we increase that from 120 to as close to 200 acute care beds as we can possibly manage. Sadly, a proportion of the patients who get COVID-19 don't just require hospital care, they require the highest level of hospital support, and these are patients that end up in the intensive care. I'm delighted to say that through the efforts of our facilities team, we have been able to increase that critical care capacity from 9 now to approximately 30 beds, so more than trebling that capacity. Our facilities department within the hospital have worked tirelessly to create usable clinical space.
Many people may think that to increase capacity, the hospital would increase the number of people in each room.
In the short to medium term, there would be no intention to make these more than single occupancy. If there were a surge in numbers, there will be obviously a high proportion of these patients who are infected, and we are in the fortunate position of quite a significant number of the beds on the 5th floor, on the Ace Barber ward, are going to be converted to negative pressure rooms, and so these become in themselves, if you like, isolation rooms for single patients. We have some restrictions. We have some restrictions on the actual number of beds that we can provide, and when I talk about increasing the number of beds to close to 200 acute care beds, that would use all of our capacity that we have available to us at this moment. We have got an order for an additional 34 acute beds to be provided on island, but the arrival date at this time is not clearly determined.
BHB is committed to caring for our community.
The leadership of the organization wishes to leave no stone unturned to make sure that the hospital serves the population of Bermuda to the absolute best of its ability. We are totally committed to doing our best as we face the challenge ahead.